In this video, I'm going to break down how we arrive at the diagnosis of type 2 diabetes to demystify it, and then I will give clear and practical solutions. I really believe that if we have clarity on what the body is trying to tell us, it will empower us to make more kind choices and step into a reality where disease is not necessary. Be sure to give this video a thumbs up and hit the bell for more health and wellness educational content. If you're watching this video, you probably know someone or you yourself are wondering about type 2 diabetes, which is one of the most common conditions in the Western world. It is a metabolic disease, so it is one of 8 top metabolic conditions that take up 70% of healthcare costs in the US today. Type 2 diabetes is treatable with drugs. The symptoms that you get before the diagnosis are not treatable with drugs. In other words, the medical system is not able to help with symptoms. Therefore, if symptoms are step 1 in the disease process, it makes sense that we would want to retrace our steps instead of jumping to a treatment that doesn't help with the root cause. This brings us to the question, why do we rely on the medical industry so heavily for treatment of metabolic syndromes such as type 2 diabetes? I would argue it's because of a lack of understanding or knowledge. I learn about metabolic syndrome as a hobby, and I also love teaching, so I will drop some knowledge, and if it resonates, awesome. If not, I had fun anyways. So first of all, the medical industry is a for-profit business model. Doctors are financially incentivized to give drugs to patients that are sold to them by pharmaceutical companies. They do not care whether you heal or stay sick. In fact, if you stay sick, then you keep paying for medication. So logically, the medical industry, which is tied to the pharmaceutical industry, benefits financially from you staying sick. So just take a step back and realize that right now we are relying on an industry that is incentivized to keep you sick. I do not think doctors are evil. In fact, most of them really have no idea what's going on. They just struggled through 10 years of schooling so that they could make 100 to 500K per year. And some of them have huge hearts for serving people, and then they get into the system and realize that the medical industry really has nothing to do with helping people and everything to do with making money. Which again, I don't think making money is evil. I'm just laying this out in a very fact-based way. When I was dealing with my health issues, I had a lot of painful symptoms, and I saw multiple doctors, and they all had pretty much no idea what to say or do because doctors are just not trained in symptom reversal. They are trained in diagnosis and treatment. All my blood work was normal. All my x-rays were normal, so they couldn't diagnose me with anything, even though I had a lot of physical symptoms. So because they couldn't diagnose me, they couldn't treat me. So with the understanding that the medical industry is not incentivized to make people better, and that medications are really just artificial versions of a process that our body already knows how to do, it makes sense that we would want to then learn how to listen to the body. The body is never against you. It is always for you. Symptoms are not something to be afraid of. They are just signs that your environment is not benefiting you. So now I'll paint a picture of 2 different scenarios of people that develop type 2 diabetes. One of them is environmental, and one of them is mostly emotional. So in Canada, where I live, there are Indigenous reserves. These reserves are where generations of Indigenous people have lived and continue to live. I trained a lady who grew up on a reserve, and she came to me with a goal of weight loss and reversing her pre-diabetes, which is basically just a fancy way of saying that her hemoglobin A1C was close to diabetic, but not completely, in the way that the medical industry defines things. We will call her Amanda. So Amanda was raised in an environment where common habits are drinking, smoking, and eating junk food. When she came to me, we started pointing her where unhealthy habits were more familiar, the healthy habits felt uncomfortable. New habits to the nervous system are seen as a threat. Therefore, Amanda had very good intentions, but because the healthy habits felt unfamiliar and threatening to her nervous system, she fell off track, and I only trained her for a few sessions, and after that she stopped coming. That scenario is environmental because by coming into a healthy environment, it was going against what her nervous system is used to, and therefore the story she told herself was, I don't belong here. And she recoiled back to the known environment. Amanda was pre-diabetic because the only environment she felt like she deserved and was comfortable with was in the known unhealthy environment. That's the first scenario. The second scenario is an emotional scenario. Type 2 diabetes is developed because the person is trying to mask depressed or anxious thoughts with food in this scenario. So I trained another lady who is the perfect example of this. We'll call her Jessica. Jessica wanted to lose 50 pounds and was also pre-diabetic. And she grew up in a 2-parent household, lived with her husband, had 2 grown-up kids, and they recently sold their company. So they were well off financially and spent most of their time golfing, traveling, and visiting family. Jessica did not lose any weight at all, and this was confusing to me because she was working out 4 times a week. I made the mistake a lot of trainers make, and I fell into a kind of autopilot and did the program without talking about lifestyles. Now, one day I was just asking her questions, and we were getting pretty deep, and she told me she was struggling with a binge eating disorder. So binge eating disorder is a habit of eating high volumes of dopamine triggering foods in one sitting, usually followed by a period of guilt triggered restriction. The binge eating was triggered by her husband leaving town for golf trips because he would leave and she was afraid of being in the house all by herself. So she would use food as a way of making herself feel better. And it just became a habit. So Jessica was pre-diabetic because she built the habit of eating sugar as a way of dealing with discomfort. In both of these scenarios, the body was giving signals. The signal in both cases was a blood marker of something called hemoglobin A1C. So in Canada, if your A1C is higher than 6.5%, you are technically diabetic. If it's 5.7 to 6.4, then you are pre-diabetic. This is the medical industry's way of deciding if you should be given medication based on your diagnosis. Now, let's just say we live in a world where people are very, very good at listening to their internal guidance system. There are a list of symptoms you will experience that indicate insulin resistance, aka prediabetes. And they are all symptoms that you can see visually or feel in your body. So here's the 11 most common ones. Acne or eczema, bloating, skin tags, farting while peeing, I'm serious, chronic fatigue, sleep insomnia, moodiness, linked to hunger, or in other words, hangriness, anxiety and depression, sugar cravings, temperature dysregulation in the body, so feeling super cold all the time or getting hot flashes, and frequent viruses or infections like strep throat or nasal infections, and you get it recurring like once a month at most, sometimes more. I've combined these symptoms with autoimmune symptoms because they are very closely linked and often occur at the same time as insulin resistance. The solution to both is to change your environment. When I was dealing with my health issues, I had a lot of the symptoms I just listed, but I didn't know what they meant. Therefore, I didn't change my behavior. Now I do know what they mean, and that's what I'm going to talk about now. The process of reversing symptoms means changing habits. I made a video called How to Lose Weight Permanently where I talk about how to change habits, and I want to expand on that a little bit more. So go watch that video if you haven't already, but I'm going to talk about it a little bit more now. All of these symptoms are normal, but not healthy in today's society. In other words, Everyone we know has at least half these symptoms. That doesn't mean it's healthy. It just means we live in an unhealthy society. And that's nothing to be ashamed of. It's just a learning opportunity. Here are 6 solutions in no particular order. Number 1, pay attention to your breathing. It should be deep and go down into your midsection. 2, deal with your emotional trauma. That looks different for everyone, but I found a lot of success with journaling with myself and clients. Number 3, eat from the outside aisles of the grocery store. That just eliminates most foods that cause insulin resistance. Number 4, get 10,000 steps per day. Movement is medicine. Number 5, eat organic when possible. Pesticides are toxic to your body and your mitochondria. Number 6, be nice to yourself. If that means avoiding mean people, then avoid mean people. So at this point, we've talked about why it's silly to rely on the medical industry, how diabetes happens from an emotional and environmental perspective, symptoms of insulin resistance, and lifestyle solutions. If you found this video helpful and you know someone who you think would benefit from seeing it, be sure to give it a thumbs up and share it. Also, let me know in the comments if this helps and if there are any topics mentioned today that would be fun to expand on more. Until then, remember that you have the power to change any aspect of your life, especially your health.